Hello everyone, I am Dr. Swati Mehta. Today I will present hypertensive disorders during pregnancy. This subject was left by me in the continuation after the abortion. So here I am concluding my topic. During pregnancy, a significant obstetric complication responsible for major maternal and fetal morbidity and mortality worldwide. This presentation will cover classification, pathophysiology, clinical features, management, complications, and homeopathic therapeutic approaches. Hypertensive disorders in pregnancy may be pre-existing or developed during gestation. They are increasingly common and remain a leading cause of maternal and perinatal complications. Early detection, regular antenatal surveillance, and timely intervention are essential to improve the outcomes. The hypertensive disorders may be chronic or pregnancy-induced, major cause of maternal and fetal risk, and requires strict monitoring. Gestational hypertension is defined as new onset hypertension after 20 weeks of pregnancy without proteinuria or feature of preeclampsia with normalization of blood pressure within 12 weeks of postpartum. Blood pressure is more than 140 and 90 mm of Hg after 20 weeks. There is no proteinuria and it resolves the postpartum. It is known as gestational hypertension. Hypertensive disorders in pregnancy are classified into gestational hypertension, chronic hypertension, preeclampsia, eclampsia, and chronic hypertension with superimposed preeclampsia or eclampsia. Key points are gestational hypertension, transient hypertension of pregnancy, preeclampsia may be mild or severe, eclampsia, chronic hypertension preceding pregnancy, chronic hypertension with superimposed pregnancy-induced hypertension, superimposed preeclampsia, and superimposed eclampsia. Gestational hypertension affects approximately 5 to 10% of pregnancies and is most common in multiple gestations. A significant proportion may progress to preeclampsia. The key points are 5 to 10% incidence, higher in twins or multiple pregnancies, risk of progression to preeclampsia. Hypertension in pregnancy leads to widespread vascular dysfunction affecting multiple organ systems, including cardiovascular, renal, hematologic, neurologic, and fetal circulation. The key points are vasospasms and endothelial injury, reduced renal perfusion leads to proteinuria, and placental insufficiency leads to fetal growth restriction. Neurological effects include hyperaphasia and seizures. Pulmonary edema may develop in severe cases. Fetal complications include intrauterine growth restrictions and oligohydramnios due to reduced placental perfusion. For management, mild cases are managed with rest and monitoring. Severe hypertension requires antihypertensive therapy and seizure prophylaxis with magnesium sulfate. The drugs methyl-dopa, labetalol, nifedipine, hydrazine, and magnesium sulfate, all these medicines are allopathic medicines, while in homeopathy we can use Apis mellifica, Baryta mur, ammonium mur, and so on. We will discuss in our further lectures. Chronic hypertension is present before pregnancy or diagnosed before 20 weeks of persistent beyond 12 weeks postpartum. It increases the risk of superimposed preeclampsia. Preeclampsia is a multi-system disorder characterized by hypertension and proteinuria occurring after 20 weeks of gestation in a previously normal woman. Or you can say there are 3 points: proteinuria, hypertension, and edema. Amongst these three, any two are present after 20 weeks of gestation, we can diagnose as preeclampsia. Preeclampsia is used to be called toxemia because it was thought to be caused by a toxin in a pregnant woman's bloodstream. The exact cause remains unknown. It is believed to involve abnormal placentation, endothelial dysfunction, immune maladaptation, and oxidative stress. The exact etiology is unknown, but it is believed to be involved immune maladaptation, placental ischemia, oxidative stress, and genetic susceptibility. Risk factors include genetic predisposition, extremes of maternal age, first pregnancy, obesity, multiple gestation, and chronic medical conditions. Genetic factors play a major role in many diseases and health conditions. Some important genetic influences include family history of the disease, inherited gene mutations, chromosomal abnormalities, ethnic or hereditary predisposition. For example, individuals with a strong family history may have higher probability of developing the same condition compared to the general population. Age significantly affects health risk because body systems naturally change over the time. Hormonal balance, immune functions, and tissue repair mechanisms gradually decline with the aging. The important components are increasing age, early or late reproductive age, number of pregnancies, and hormonal exposure over the time. Partner-related factors may contribute to health risks through genetic, behavioral, infectious, or lifestyle influences. These factors may include sexually transmitted infections, multiple sexual partners, poor reproductive health awareness, lifestyle habits such as smoking or alcohol, genetic compatibility issues, and certain infections transmitted between the partners may increase long-term complications and disease risk. Pregnancy causes major physiological and hormonal changes in the body. Certain pregnancies related conditions may increase the future health risk. High risk pregnancy includes gestational diabetes, hypertension during pregnancy, recurrent pregnancy loss, pregnancy complications, hormonal fluctuations, and these conditions may affect both maternal and fetal health and may predispose individuals to chronic disease later in life. Pre-existing medical conditions can weaken the body's defense mechanisms and increase disease susceptibility. Common contributing conditions include diabetes mellitus, hypertension, obesity, autoimmune disorders, chronic infections, hormonal disorders, and this disease may impair immunity, circulation, metabolism, or organ functions, making complications more likely. Many additional environmental and lifestyle related factors may also contribute to the disease risk. They include smoking, alcohol consumption, poor diet, physical inactivity, stress, exposure to toxins or radiation, socio-economic conditions, lack of healthcare access. Lifestyle and environmental influences are often modifiable, making prevention and education very important. Development of hypertension with proteinuria induced by pregnancy generally into the second half of gestation, more frequent at the extremes of reproductive years, and more common in a woman who have not carried a previous pregnancy beyond 20 weeks. Preeclampsia is divided into two, mild and severe. The clinical features of preeclampsia are hypertension, proteinuria, edema, headache, visual disturbances, epigastric pain, and oliguria in severe cases. Mild disease shows moderate hypertension and proteinuria, while severe disease includes blood pressure equal or more than 160, that is systolic, and 110, that is diastolic, with multi-organ involvement. Complications include placental abruption, renal failure, disseminated intravascular coagulation or DIC, cerebral hemorrhage, and maternal fetal mortality. Predisposing factors includes a woman having age less than 20 years or more than 35 years, maybe Indian or Pacific, obese, improper diet, working in pregnancy with high stress, relationship with a partner less than 3 months, previously involved in preeclamptic pregnancy, small for gestational age of a woman. There may be family history of preeclampsia, hypertension, diabetes, PCOS, or underlying thrombophilias, obstetric history of previous preeclampsia or donated gamete, and there is multiple pregnancy. All are the risk factors to develop preeclampsia. Prevention includes low dose of aspirin, calcium supplementation, and close monitoring of high-risk pregnancies. In homeopathy, we are having many medicines to prevent preeclampsia, where there is a edema, hypertension, or there is a edema and proteinuria. We are having many medicines, and any of the medicines which is related to the patient or similar to the patient, we can prescribe to prevent. Management depends on severity and gestational age. It includes antihypertensive drugs, magnesium sulfate, and timely delivery. So, antenatal and intranatal part is very important. Severe case of preeclampsia, regular antenatal checkup of every week is very important after completion of 28 weeks of gestation. In case of severe preeclampsia, the guidelines for expedient delivery, the maternal indications are thrombocytopenia, pulmonary edema, acute renal failure, persistent severe headache or visual changes, elevated liver enzymes with persistent severe epigastric pain or upper quadrant tenderness on the right side, labor or rupture of membranes, and there is vaginal bleeding or there is abruptio placenta. Fetal indications are there is repetitive severe variable or late deceleration, intrauterine growth restriction, or there is IUD, intrauterine death of the fetus. Amniotic fluid index is less than 2 centimeter. Biophysical profile is less than 4 on 2 occasions and 4 hours apart are known as severity of the preeclampsia. In case of mild preeclampsia, complete bed rest is required, and if needed, hypertension therapy is given. In case of severe preeclampsia, antihypertensive therapy and induction or cesarean section is required. Symptoms for diagnosis of severe preeclampsia are severe headache, diminution of the vision or temporary blindness, severe epigastric pain and vomiting, sudden diminution in urine output or even complete suppression. A sudden rise in blood pressure usually precedes the occurrence of fits. Eclampsia is the occurrence of generalized seizures in a woman with preeclampsia, not attributed to other causes. Or you can say it is defined as generalized convulsions associated with proteinuria and edema during pregnancy or labor or within 7 days after the delivery. For the management of eclampsia, immediate stabilization is followed by magnesium sulfate administration, control of the BP, proper oxygen support, and definitive delivery after stabilization is must. Flowchart indicates the development of preeclampsia and eclampsia with predisposition factors. HELLP syndrome is a severe variant of preeclampsia characterized by hemolysis, elevated liver enzymes, and low platelet count. The clinical features are severe hypertension, epigastric pain, nausea and vomiting, visual disturbances, proteinuria, edema. The complications are DIC, liver hematoma or rupture of the liver, renal failure, placental abruptions, maternal and fetal mortality. Treatment of HELLP syndrome. The initial management is admitted to ICU, stabilization, magnesium sulfate, antihypertensive drugs, and urgent delivery is required. After that, postpartum care is must. Continue monitoring for 48 to 72 hours, watch for bleeding, renal failure, and pulmonary edema. Homeopathic therapeutics in hypertensive disorders of pregnancy are selected according to the individual symptom picture and systemic involvement. Remedies are mainly indicated for edema, renal complications, hypertension, and convulsive state associated with preeclampsia and eclampsia. Apis mellifica is indicated in marked edema with puffiness, scanty urine, albuminuria, and absence of thirst. Peculiar symptom is bag-like puffy swelling under the eyes without thirst. There is dropsy. Burning and stinging pain. That is also a peculiar symptom. Incontinence of urine with great irritation of the parts and can scarcely retain the urine a moment, and when passed scalds severely. So that is also a peculiar symptom for preeclampsia. The tongue is having vesicles on the edge and swollen. Patient breathing feels as if every breath would be his last. So patient is having air hunger. So here we can say there is a hypertension and there is an edema. Albuminuria is also present in urine. So all the symptoms of preeclampsia we can find out in case of Apis mellifica. Mercor is indicated where there is burning urination, scanty and bloody urine. There is severe tenesmus, albuminuria in early pregnancy, and phosphorus is in later pregnancy and at the full term. So phosphorus is also one of the medication for preeclampsia. Hot urine, suppressed urine, tenesmus of the bladder, and there is intense burning in urethra. Hot urine passed drop by drop. There is stabbing pain extending up to the urethra into the bladder. Patient having perspiration after urinating. Continuous urging to stool and urine. There is history of nephritis of pregnancy and cystitis. Renal irritation and nephrotic conditions in pregnancy are the clinical use of this medicine. Cantharis is indicated where there is intense urinary burning, urine pass drop by drop with blood, violent urinary urgency, violent paroxysms of cutting and burning in whole renal region with painful urging to urinate, intolerable and tenesmus, cutting before, during, and after urination. Urine scalds her and is passed drop by drop. Constant desire to urinate. Patient is so having fear, because severe burning. So when she passed urine, she has to be scalded out, and there is painful swelling of the genitals and dropsy. So all the symptoms indicate where there is an acute urinary tract infection with toxemia of pregnancy, we can use cantharis. Kali chlor is used for the toxemic conditions of pregnancy where there is swollen face, swollen in the morning, ankles in the evening. There is chronic nephritis, albuminuria, albuminous urine which scanty and suppressed. There may be hematuria. Urine contains nucleoalbumin and bile, high phosphoric acid with low total salts. So when we analyze the urine and we find out this conditions or this substance in the urine, we can use Kali chlor. Kali chlor you can use blindly also because it is a specific medicine for toxemia of pregnancy. Cicuta virosa is a medicine for eclampsia where the convulsions are present. Delirium with singing, dancing and funny gestures, spasms and cramps in the muscles of nape of the neck and spasmodic drawing backward of the head, locked jaw and distortions of limbs, red or blue face. There is opisthotonus, means curved limbs cannot be straightened or straightened limbs cannot be curved again. That much of tightness we can find out while convulsions. Puerperal convulsions where there is a frequent suspension of breathing for a few moments as if patient is dead, and then upper part of the body most affected and continue after the delivery also. The convulsions with swelling of stomach, violent spasms of diaphragm, with frightful distortion of the limbs and the whole body. It is aggravated by slightest touch, noise and jar, and patient is having opisthotonous condition with the locked jaw. So typical seizures of eclampsia we can find out in cicuta virosa. This is the second medicine for eclampsia, cuprum metallicum. The convulsions with blue face and clenched thumbs. The clonic spasms beginning in fingers and toes and spreading over the entire body during pregnancy and puerperal convulsions. Aura begins in the knees and ascends, aggravated at night and during sleep. Spasmodic affections, cramps and convulsions beginning in the fingers and toes. So if we want to differentiate cuprum metallicum and cicuta virosa, cuprum is centered periphery to center because it starts from the knee and then the convulsions affects. So periphery to center, that is cuprum metallicum, and center to periphery, that is convulsions end into the opisthotonus, then it is cicuta virosa. Belladonna is used when there is congestive stage convulsions. The flushed face and cerebral congestion. Face is hot, eyes are glaring, dryness of throat with aversion to water. Patient is having convulsions, and with that patient describes a forcing downwards of a female genitalia as if all the viscera would protrude. So that is the sensation of the patient with convulsions. Veritrum viridi is used where there is a severe hypertension and there are chances of collapse. Cold cami skin, pupils are completely dilated, cannot hold the head up, violent painful hiccups and spasms of the esophagus, beating of the pulses throughout the body, convulsions with dim vision, opisthotonus with cold cami perspiration. The tongue is coated white with red streaks in the middle, and the pulse is slow, soft and weak. So when there is very severe conditions of eclampsia, we can use veritrum viridi. Oenantha crocata is used when patient is having history of epilepsy, so here there is status epilepticus or development of the convulsions, which is puerperal convulsions. So puerperal eclampsia, uremic convulsions, and convulsive facial twitching we can find out after delivery with mania, and there is status epilepticus. Opisthotonous conditions we can find out. The hands and feet are cold, we can use Oenantha crocata. Homeopathic therapeutics in hypertensive disorders of pregnancy are selected according to the individual symptom picture and systemic involvement. Remedies are mainly indicated for edema, renal complications, hypertension, and convulsive states associated with preeclampsia and eclampsia. Apis mellifica is indicated in marked edema with puffiness, scanty urine, albuminuria, and absence of thirst. Mercor is useful in severe renal irritation with burning urination, tenesmus, and bloody urine. Cantharis is prescribed when there is intense burning in the urinary tract with constant urging and nephrotic involvement. Calichlor is indicated in toxemic conditions with chronic nephritis, edema, and albuminuria. For convulsions, Cicuta virosa is useful in violent spasms with opisthotonous and distorted limbs. Cuprum metallicum is indicated in clonic spasms beginning in fingers and toes with exhaustion after convulsions. Belladonna is suited to congestive convulsions with flushed face, cerebral excitement, and throbbing carotids. Veratrum viridi is used in severe vascular excitement with hypertension, cold perspiration, and circulatory weakness. Oenantha crocata is considered in recurrent epileptic form and puerperal convulsions. Thus, homeopathic management is individualized and supportive based on characteristic symptoms and the patient's constitutional state. Today's topic is hypertensive disorders during pregnancy, and it is an important obstetric condition where I have already explained about the gestational hypertension, preeclampsia, eclampsia, HELLP syndrome, risk factors and complications with modern management and homeopathic therapeutics and key indications of the homeopathic medicines. I have explained each topic in a simple, professional, and exam oriented manner useful for the BHMS and MD homeopathic students, medical students, and practitioners. If you find this video helpful, please like, share, and subscribe to the channel for more medical and homeopathic educational content. Thank you for watching my video.